We move on to our next speaker, Dr. DARYL Turner. He is the MD of Nitec Medical Company. He is the inventor of Thyroflex testing machine. Many of you have been asking in the chat, what's Thyroflex? So you will know more about it from Dr. DARYL himself. He's also the director of Uniworld Healthcare. So Dr. DARYL is a hormone specialist, and his focus is on thyroid, iodine, adrenal, and DNA RNA. So he invented, patented, developed, and clinically trialed hormone testing devices and the supporting medications for the treatment of hormonal imbalances. And he has also discovered an effective treatment for Hashimoto's disease, for Graves and RT3, and has developed effective protocols for balancing the core hormones. Now, often we hear thyroid disorders run in the family, right? Is it really genetics? And if it is, how do we tackle that? So Dr. DARYL will be sharing insights on that. He will discuss about a simple, effective solution where you can help your patients from, from the effects of thyroid disorders in case if it's running in the family. So let's hear more from Dr. DARYL. A very warm welcome, Dr. DARYL.
Thank you very much. I'm going to share my screen and bring up a PowerPoint. So I assume that you can see that?
Yes.
Good. So my name is Dr. DARYL Turner, and I can't get my slides. Here it goes. This is my family, my wife of 52 years, my 2 children, and my grandchildren. We live in Scottsdale, Arizona. I specialize in male and female hormones. Very eloquently covered by Dr. Prudence Hall, and of course Dr. Nomi, who, by the way, has treated tens of thousands of patients as well for thyroid on our behalf. And Dr. Prudence Hall, I've worked with her for the last 20 plus years, and she is, in my opinion, number one. So we're very privileged to have both of them on. These are the books and boards, lots and lots of coverage. And in India, the life expectancy up until 1941 was very, very low, right? We didn't have to worry about our hormones very much because it was only 31 years of age. If you got past 31, but in the 1940s, you were extremely old. Nowadays, as you can see, the life expectancy has gone up substantially. And of course, now we're worried about how well we feel. What is the quality of our life? We're now living a lot longer, so we better have our hormones balanced. The progesterone, estrogen, testosterone has been beautifully covered by both doctors who just preceded me. But what about the thyroid? So many patients come in and say, "Doctor, my doctor doesn't even ask me about the symptoms." In other words, the traditional medical community are sticking to TSH and and they don't ask the questions because they don't have enough time with you. But we have found over the years that it runs in families, and this one here is a statement from the Genetic and Thyroid Function Disease by VJ, and they found that up to 67% of the thyroid cases were genetically triggered. by DNA. But this was determined by TSH. And TSH, as we've just learned, is not a good marker of thyroid function. In fact, this is a very well known doctor out of at the Cleveland Clinic, and Dr. Nassar said that over 75% of the time, patients with thyroid disease tell me that someone on their side of the family has it. When I talk to patients, I find that it is more like 90%, especially when you start mentioning the symptoms like Alzheimer's, Parkinson's. They say, oh, my uncle's got that, my auntie's got that, my mother's got that. And they say, well, I said, there is the connection. In other words, thyroid runs in families because it is a genetic disorder. And I'm just trying to make my slides go on. Oh, it's a Cleveland Clinic. I wonder why my slides won't progress. Here it is here. So I developed many years ago Dr. T's core hormones. It's a registered system that I know that that Dr. Prudence Hall and Dr. Naomi Quinn and I both use. And we look at sleep, we look at blood sugar, we look at thyroid, and of course, we look at the stress hormones. But let's start with the thyroid. We all know where it is. It's this little thing right down to the base of our neck. If it's not balanced, the quality of your life deteriorates and it controls your weight. You tend to put on weight, and people don't like that very much. So the question is, why do we still use blood? In fact, blood didn't come into the picture until the mid-1970s. Before that, we used symptoms and the speed of the reflexes. In other words, I can remember in the 1940s and 1950s, my doctor used to sit me on his table and tap my knee with a reflex hammer, and he would judge the speed of my reflex, ask me some questions to decide whether I needed thyroid or not. I developed a thing called the Thyroflex, which tests the speed of the reflexes and neurotransmitters, the resting metabolic rate. In other words, this is based on old-fashioned medicine, right? I'm going back to what are the speedy reflexes. In fact, Dr. Prudence Hall, you can nod for this. When you were younger, you used to do a thing called a heel kick or a heel kick test, correct? That was looking, and you could judge the speed of the reflexes from the heel kick, from the time the baby's born, right? And if it was slow, you had to give the baby immediately, the newborn child, immediately thyroid. I did clinical trials on 3 years on 2,200 people. I discovered how to reverse Hashimoto's. On peer review, published, FDA, CE, TGA, and of course, recently we just got the FASI approval on our medications. We operate in 28 countries. I have patents issued. And in February 2022, I passed patient number 2 million, of which 1/3 of a million of those were Hashimoto's. According to Dr. Terry Hertog, who Dr. Prudence Hall just mentioned in her presentation, and Broder-Barnes, they postulated in their books that over 80% of the population have a thyroid disorder. The official numbers are a lot lower because they go on TSH and bloods, which do not pick up thyroid disorders, and we're going to discover that in a minute. In other words, if this is a genetic problem, which we've just covered, then what are the solutions? We have to have the solutions to the problem. So we have found out with over 2 million patients under our belt that's about right. It's about 80% of everyone we test have a genetic predisposition to being hyper or hypothyroid, and it leads to a lot of problems. Before we go on, there's one very, very simple question. If any of you are giving your patients thyroid, are you giving them iodide, and are you giving them D3K2? Why? Thyroid is like petrol, D3K2 is like oil, and iodide is like water. It's what makes your car, the petrol, oil, and water is what makes your car engine work. The thyroid D3K2 and the iodide is what makes your mitochondria work. Your mitochondria is your energy source within your cells, and that's and as both doctors were stating before, your patients get tired and exhausted and worn out because the engines are not running or not performing properly. This is a statement by Sir Dr. Richard Bayliss, head of the Endocrinology Society in Europe, and very famous endocrinologist. In fact, he's the endocrinologist of the royal family as well. He stated a few years ago that none, N-O-N-E, of any of the bloods, be it TSH, T3, T4, T3, T4, are valid for determining thyroid function. In fact, he went on to say that the only thing that are valid are the symptoms, which is in my symptoms questionnaire, and the speed of the deep tendon reflexes, which is what I developed to test. So to summarize it, he said that your thyroid, symptoms, reflexes, not blood. So there is a solution out there. Now, according to a very famous doctor as well, it's called the Waltman's effect. It shows that that hypothyroid patients have slow or delayed deep tendon reflex. And this was well established back in the 1940s and 1950s. And many in the 40s and 50s, many researchers decided to investigate the speed of the reflexes. That is, they tested the Achilles, and they found very good correlation between a thyroid dysfunction and slow Achilles reflexes. In fact, these are just few of the many studies that got page after page after page of the ankle reflex, thing called photomotograms in thyroid dysfunctions. So the speed of the reflexes and thyroid function and not blood is very, very well established, and was established 50 to 60 years ago. And before that, the doctors of old knew about the speed of the reflexes, and that is why when I was a child in the 40s and 50s, they used to tap me on my knee to judge the reflexes. Here we have my friend Terry Hertog again, and I actually co-lecture with Terry. And as Prudence was just saying, it's between 0.5 and 1.5 is the maximum your TSH should be up to. But look at the, and I know in India is extremely high, way above this. But look at all the different endocrinology societies here and here and here and here, and they keep on varying this year after year after year. In other words, if your TSH is beyond 2.5, you're at very high risk of developing long-term autoimmune disorders and suffering severely from hypothyroidism. And that's why the endocrinology societies of various countries keep on altering this range, because they can never, ever hit target, and they never, ever will try to do it by blood. Here are the symptoms of hypo. You're tired, you're confused, you've got hair loss, you start out like this, and you just can't help yourself because it controls your resting metabolic rate. It plays a major effect on your brain, and of course as we were talking about before, both doctors were talking about that it can cause congestive heart failure. So what are the symptoms? This is from my endocrinologist handbook, right? If you score 8 or more on this, if a patient, this is rated 1, 2, 3, if they score 8 or more, they are by definition subclinical hypothyroid. And as Dr. Naomi mentioned, she has a 16-page list of all the symptoms that go way, way beyond this. Dr. Prudence Hall just tied it, thyroid function in with estrogen. That's this one here, and the progesterone. But the green ones are the brain. And these are dead giveaways. As soon as I shake someone's hand, hands are hot cold. I suspect that they have a thyroid dysfunction. And of course, a lot of women come up and say, hello, how are you? It's because thyroid affects the vocal cords. This is the big one here. They say, doctor, I'm exercising, I'm dieting, I'm doing everything. I keep on putting on this weight year after year after year. Why? And I've had elite athletes who come in and say, why am I putting on these bumps around my middle? Because the thyroid is not right. Hyper, shaking, skipping of the heartbeat, rapid heartbeats. And of course, with the hyper, there's also indicative, that's the palpitations, tachycardia of being autoimmune. As soon as I see palpitations and or tachycardia, that automatically triggers TPOAB and TGAB, the autoimmune tests. I have to, before I treat a patient, I have to rule that out. But usually we're pretty well accurate on this here. We get the test back, and it's usually Hashimoto's or Graves, and sometimes both. So what exactly is subclinical hypothyroid? As we said, if you score 8 or more on the symptoms list, you are by definition subclinical hypothyroid. Where do we get that term? We as doctors park their patients there because they come in, they have all the symptoms, their TSH or their blood test would appear to be normal. We say go home. We wouldn't treat them in the past. Now we have the solution, and that's what I'm going to talk about today. We know the problem is genetic. We know the patients have the symptoms. The blood test is not going to show. So how do we progress, and how do we relieve the patients of their misery of being and suffering from hypothyroidism, and of course, it's developing into autoimmune. Last month I was sitting in front of Dr. Pretty in her office, and she says, "Dr. Turner," she said, and you can nod your head, Dr. Pretty, and she says, "You won't believe it." She says, "I believe that 80% of everyone who comes in here who has the thyroid disorder has Hashimoto's." 80%. And I said, well, I'm finding the same. I said, I just gave a lecture to a FICCI group of about 250 women, and I found virtually all of them had an autoimmune disorder, where in the USA, Australia, and all the other countries we operate in, it's about 18%. And I think that Dr. Prudence Hall would agree with that. It's only about 18%. So I said to Dr. Pretty, I says, I think I know why. And I explained to her why. The incidence of autoimmune is so high in India. But look at this, your basal body temperature, that's the Broder Barnes, is low, but it's very slow to move. Your reflexes are slow. That's been well established. Your resting metabolic rate is low because thyroid controls how many calories you burn per day. And we measure that. And look at this. All your blood tests appear to be normal, right? Perhaps your TSH may be high, but high on what standards, right? But remember what Sir Dr. Richard Baylor said. He said that bloods are invalid. It's only symptoms and reflexes that are valid. If you don't treat your patients, if you ignore them, and this has been the problem with your aging patients in India, they come in with the symptoms, their blood tests appear to be normal, you expose them to a lot of risks. And I have these risks grouped. The first one is cardiovascular risk. I'll talk about decreased stroke volume. That's when the left-hand side of the heart goes boom, and the right-hand side of the heart goes boom. Actually, it's back to front. Right hand goes boom, left-hand side goes boom, 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 boom. And you get fluid retention in the outer limbs. In other words, your heart is not beating in a regular pattern to enable it to circulate the blood efficiently through your body. So you start to get fluid retention. And there is a lot of other symptoms caused by low, treated, undertreated, or underdosed hypothyroidism. This is the disruption in the GLP-1 signaling. If you have a diabetic patient, you better have their thyroid right? Because if it affects the GLP-1 signaling pathways, and if your GLP-1 signaling pathways are not corrected, you're going to be very difficult to get your type 2 diabetic patient back under control. And of course, this is why a lot of your patients who are eating correct, doing everything correct, their triglycerides and their HDL and the homocysteines are not in balance. Here we have the arthritis and inflammation, of course, Hashimoto's, but all the joint effusion, all your different joints, rheumatoid arthritis, and of course it goes straight to your gut. And I'm going to cover the cascade of autoimmune hormones shortly because it goes way, way beyond this. And of course, it doubles your chance of Alzheimer's. This is a very well-known study that 50% of all Alzheimer's have a dysfunctional thyroid. Therefore, we simply ask a patient this. If you want us to halve your patients or your risk of getting Alzheimer's, we must treat your thyroid. It's as simple as that. Do you want to go through that? Most patients do not want, and I don't know why, do not want to get Alzheimer's as they age. A little bit strange, but most of them, we say to them, look, we're going to have to put you on thyroid, D3K2, and iodide. If we do that, we will halve your chance of getting Alzheimer's. Do you want that? And they say yes. Also, the Deprene's contracture and a whole lot of other things that I see quite often in India as I'm traveling around. Really, this was very well covered by Dr. Naomi and Dr. Prudence, but difficulty getting pregnant, and of course, miscarriages and the trauma of miscarriages that puts on a relationship, and of course the difficulty of carrying a fetus past the first trimester is difficult if your thyroid is not, let alone getting pregnant, is not covered. There are lots of other things that here, though, I mean, that from long term, but just look at this, depression. So many of your patients come in with depression, anxiety, schizophrenia, psychosis, bipolar. That's just a few of the things that you as doctors have to deal with, right? If a patient comes to me and they're on depression, they're on medication for depression, it's covering the symptoms, it's covering the core root cause. We get them off their antidepressant medications, just as one thing, because the underlying cause is your hormones. And of course, we start with the thyroid first. Now, we have a very simple solution. It's a 4-minute test, and we refer to it as a ThyroFlex test. It actually determines your thyroid function in a matter of 4 minutes. What we did is that we took the guessing game out of do you or do you not have thyroid, because you can't tell by bloods, and we also are able to titrate you exactly to the right dosage. So you make an appointment, you go through a ThyroFlex test, and I'm going to cover the ThyroFlex test at the end of this presentation. What else can go wrong? Graves, Hashimoto's, thyrotoxicosis, reverse C3, and thyroid cancer. For most of our doctors there who are listening to this, we have incredible protocols for Graves, Hashimoto's, hashimotoxicosis, and reverse C3. I will cover those in a minute. And of course, we don't have a solution for thyroid cancer, but those 4 there, we have very effective treatments. In fact, we haven't had those 2 million patients, we've been able to avoid a partial ablation for Graves, which is quite an outstanding record. Because there are other ways of attacking. There's 2 types of Graves, and here's a guy called Marty Feldman. He was a very famous actor. You see the bulging, the pressure behind his eyes, and making his eyes bulge. He's very skinny and slim, right? And as Dr. Prudence Hall, he's got the classic fluid retention in and around the eyes. And he died young of Graves. Here's another famous actress, and she has Graves as well. But the bulging eyes, as soon as you see a patient, we can pretty well pick out Graves straight away. Not very many people have Graves. It's one of the minor, is more in thyroid disease, is one of the lower risks of autoimmune. But Hashimoto's is a lot more common. And as you can nod your head, Dr. Pretty, but as Dr. Pretty said, Hashimoto's is rampant. Right, Dr. Pretty? Okay, I'm not getting any response. So it's not 18%, it is more like 80% in India. So don't forget, in my clinical trials over 3 years on 2,200 people, I not only were able to put them into remission, I'm able to absolutely cure them. So when you run the Hashimoto to TPO-AB, it is 0. We're able to get our patients down to the autoimmune marker of 0. Here's a cascade of autoimmune responses. If you don't get it under control, that is, first place it goes to is your digestive system. It can then go into Crohn's, ulcerative colitis. A lot of people don't think about this. This then communicates with the brain. So there's a gut-brain connection. MS, MG, I can go on and on and on. You can read this for yourself. Guillain-Barré. But these are all part of the autoimmune response triggered by mistreated, undertreated, undiagnosed, or undertreated hypo or hyperthyroidism. Hashimotoxicosis is when you have the antibodies to both Graves and Hashimoto's. And as soon as we see that, we require a DNA genetic test. The DNA genetic test means that there are mutant genes in there somewhere. And here are a typical gene report we get. This one here is cellular inflammation, but these ones here all mean something else. These should all be green. The gold and the red means that the genes are mutant. This is a patient here, Cara, 57, female. She feels terrible. She's having difficulty walking. Her joints are seizing up. She's getting irritable and a whole lot of other things, right? And because the genes are mutant, we do an RNA intervention, we are able to reverse this. In fact, we've been doing this for a number of years now, and it virtually, as a doctor, brings tears to my eyes about what we can do with these patients. Some of them can't even get out of a chair and walk, and I'm getting them up walking again, getting their lives back to normal. You don't have to learn about this. We do a thing called a co-consultation with you and your patient over Zoom. Your that's your patient and myself over Zoom. And we say this is a 6-month intervention and we're going to correct your RNA so that the signaling between the DNA and say your brain, liver, kidneys, wherever it's going to, is corrected. Number one is stress. You can't treat thyroid without addressing stress and sleep. The first one is stress, but people do not realize as a doctor, I'm not stressed, right? In fact, I've just been commissioned to write a few books, and my first 2 books that I've just finished completed writing. The first one is on sleep, second one on stress. I'm just doing the final edits to them. But look, stress comes from coffee, caffeine, sugar, which is poison, white flour products, toxins. I've just been in India for 2 months. Have a guess what I was breathing in, right? I could cut the air with a knife. It was so bad. Poor eating habits, lack of relaxation, fear. Most people think of this area here, financial pressure, marital stress, etc. But it can come from many other areas. So we have to address the adrenals, and we have a very effective way of determining whether your adrenals is either short-term or long-term. Short-term being it takes about 6 months to reverse the adrenal fatigue, but it can take up to 12 months for severely adrenally exhausted patients. Too much stress, and it leads to reverse T3. Up until recently, you haven't been able to get the reverse T3 test in India, but I've just made a deal with the blood testing lab, and the RT3, TPOAG, and TGAB tests are now completely widely available throughout India. And the RT3 test, I found that the incidence of reverse T3 is a lot more prevalent in India than in other countries, and the RT3 is vital to get under control. We have an outstanding protocol for reverse T3, which we usually able to reverse within a very short period of time of the 30 days. We also look at the stress hormones. People who are very stressed, we run a cortisol test. This is that we take saliva tests. We take it 4 times a day. You should be up about here when you wake up in the morning. This is upon waking. A lot of people are way down here. They are adrenally exhausted, and this is called flatlining. This patient has flatlined. Of course, it's going to affect their sleep because it was got to be up here to trigger 5-HTP, right, which is tryptophan and serotonin. So you've got to have that. You've got to have the cortisol to trigger the rollover into tryptophan, serotonin. I'm going to cover that in a few minutes, and then of course that rolls over into melatonin to keep you asleep. If your cortisol is low, if you're adrenally exhausted, it's not going to happen, and it has a major impact on your sleep. So the too much stress leads to Addison's and Cushing's. And we just put our hand on the back of the neck, and we can feel a little fatty hump on the back of the neck, which is indicative of Addison's or Cushing's. And of course, you have to address that. But it has the reason why is the adrenals have a major impact on thyroid function. I'm going to cover that in a few minutes. But it also has a big control on your immune system. Here we have the adrenal axis and the thyroid axis side by side. You see that stress inhibits on 3 different levels the ability of the thyroid to work. So quite often, if you give a patient thyroid medication, it's been interfered with because of the action of either the hypothalamus, the pituitary, or the adrenal cortex or adrenal medulla on the thyroid. In other words, you're able to inhibit it, or the stress inhibits it at 3 different levels. And of course, we just covered this. Inhibiting it too much causes a response called RT3, which is a T4 problem. I know it sounds like an oxymoron, but RT3 is a T4 problem. Instead of converting into free T3, it converts into 3TF back to front, and the body cannot use it. I've been called in as an expert witness, actually, for instance, in Dubai, where a doctor has, against my advice, given a patient an additional T4 because their TSH was kept on going up and up and up, and they just gave them more T3. And they did. I said, you've got to test it to reverse T3. They didn't, and the patient died. So you've got to be super, super careful. And that is why I arranged for reverse T3 to now be tested and not be sent overseas in India. It's now available right throughout India. And of course, we have some little nutrients here, which we actually put into our medications. All the selenium, vitamin D, which Dr. Prudence Hall covered very nicely. The iodine, we actually put into our thyroid medication, and of course, we put into our adrenal medication, because these are vitally, these additional supplements are vitally essential at time of taking the thyroid. Iodine. Okay, why is the prevalence of autoimmune so prevalent in India? Well, my theory is because it's a very healthy diet, because of the amount of patients in India that are vegetarian. Vegetarian diet triggers an autoimmune response within the mitochondria. I have a little diagram on that. But here's enough iodine, too little iodine, or no iodine at all on a vegetarian diet, because iodine used to be in our food, in our vegetables and fruits. It's not anymore because of intensive farming, but your thyroid enlarges. Enough iodine to stay small, it enlarges because your thyroid is struggling to put out enough T4. It can't. So you get these little lumps that you can feel when you palpate the thyroid, and it enlarges, and you can easily feel the thyroid being enlarged. But iodine is vitally efficient. This is my friend Doug. You can see that he's got 2 thyroids, or appears to have 2 thyroids. Of course, this is a goiter. We have a special protocol for that's 87% effective. His regular GP wanted to send him to have it removed. We gave him our protocol of high dose D3K2, which boosted his own immune system, and high dose, very high dose iodine and iodide, and it reversed this beautifully. He no longer has a goiter, and his thyroid is now functioning properly. So the D3, which we're just about to cover now, is vitally important for autoimmune, but it's vitally important to open up the receptor pathways, as I just mentioned before, for the iodine, the D3, and the thyroid to perform. We used to be able to get D3 out of our sunshine, but as I learned in India, it was very difficult to see that sun underneath the fog and smog that I had to battle with every day, let alone being indoors or inside of a car most of the time. And of course, I wasn't working outside. But it exacerbates the autoimmune response, right? So that is why the levels of vitamin D are vitally important. So we give our patients, all of our patients, a minimum amount of vitamin D. But if they're autoimmune, we actually give them a lot higher doses. As I said, we can cover the protocols later. Finally, sleep. If you're not sleeping 8 hours and 10 minutes of uninterrupted sleep, you have a problem. I've written about this in my latest book about sleeping less than 7 hours a day, uninterrupted, causes you many, many problems. And here's a few of the problems that I have put here. But there's more than this, right? So we have to address sleep. For us to balance the thyroid, we have to address the adrenals, the stress modulators, as well as giving the patient thyroid if they need it, and of course, sleep. Here we have tryptophan and serotonin, which we combine into something called 5-HTP. And of course, if you don't get this right, this is what will send you to the fridge to eat when you don't want to eat, right? You raid the fridge. And melatonin, so it goes tryptophan, serotonin, melatonin, triggered by enough cortisol, right? That's your adrenals. So and of course, this is assisted by magnesium. So gut and health problems, sleep problems, of course, are determined by lack of melatonin. And of course, as Dr. Prudence Hall just said, many of her menopausal women, because I have sat through many consultations with you, Prudence, say, I can't sleep. Doctor, I can't sleep. Please help me. Please help me. And they want to kill their husbands, right? They become unstable when they're not getting enough sleep. You say, hey, how many hours sleep did you have last night? They say, oh, about 4, if that. So sleep must be addressed and it must be balanced in balancing of the core hormones. This is what tryptophan does. This is what serotonin does. But don't forget that tryptophan, serotonin, they actually not only control your sleep, but it also stops or inhibits many of the cancer cells from growing. And that is why the right amount of sleep triggered with the right amount of melatonin is very important to keep cancer at bay. Artificial lighting, I go this into book quite a lot about the temperature of your room, the way you sleep in bed, the many other things, and I can cover that separately with you. And after this presentation, magnesium is vitally important, and we give a thing called Trimag. It's 3 different types of magnesium. It's definitely not magnesium citrate, but magnesium is within the building blocks. It has other uses for the RNA, DNA, but it also relaxes the brain as well as the muscles, and that's why the use of magnesium is vitally important. And quite often, if a patient needs GABA, and we determine that in our symptom survey, they need GABA, we move that to the night because GABA is also vitally important. And if they're having sleep issues, you've got to move the D3 they take into the night as well. Now, finally, I'm about to come to the end of my presentation. A lot of you were asking online on the chat session, which I sort of typed a few answers. What is a Thyroflex? A Thyroflex is an old-fashioned machine that accurately measures, with extremely accurate in a 4-minute test, the speed of the reflexes, the speed of the neurotransmitters, and the resting metabolic rate. And in 4 minutes, you have an accurate measurement of whether you need thyroid or not, or whether you need more thyroid. This is the way to titrate. So the patient fills out a questionnaire, and this is which I think some of you have been sent. Dr. Pretty, was this sent out, or this questionnaire sent out?
Yes, we had shared this.
Oh, good. Thank you. And oops, I'm going the wrong way. This combined with this is the most effective tool you can ever have to the treatment and balancing of the core hormones. You get a test result, you get these graphs. From here to here is 1 second. From here to here is less than half a second. We're measuring in milliseconds. From here to here is your neurotransmitter speed. From here to here is your reflex speed. If it was in the red, and this is in the red, that's your resting metabolic rate, and your speedy reflexes in the red, and you have the symptoms. This patient only weighs 110 pounds, but she has symptoms of 12. That's more than 8. She doesn't appear to have any autoimmune. She has fibrocystic breast disease, ovarian cysts, uterine fibroids, which we're going to treat. Then we simply dose this patient with 1 grain of bioidentical thyroid, iodine, iodide, and D3K2. We bring her back in 30 days to titrate her. This is 98.5% accurate. And don't forget, I did clinical trials on 2,200 people and tracked them for 3 years. I've just been commissioned to write 5 books. The first 2 books are on, I've already written. One's on stress, one's on sleep. And I'm doing another 3. The publishers actually pursued me to write these. And this is a couple of quick case studies. This is Aruna from Nasik in India. This is we've been operating in India with our Thyroflex for about 15 years or more. We have quite a few Thyroflexes in various hospitals and clinics. But this is Aruna, right? She's been to see doctors all over Europe. This is her here, all over Europe, USA, trying to find a solution to her problems. She was hashimotoxicosis. She had both Hashimoto's and Graves'. She looked at me and said, I've heard it all before. She was very skeptical. I said, please, I said, try it out. And if it doesn't work, it doesn't work. This is what she says. It totally changed my life, so much so that I wanted to shout to the rest of the world, there's an answer out there. My symptoms are gone. I've lost a lot of weight. The shape of my face and body have changed. And this is her. When I started with her, you see that she's hiding behind her sister. She's trying to put on a face, smiley face. Her arms are not overweight. This is after 1 year. It takes us 1.5 years to 2 years to pull a thyroid patient out. This is her after 1 year, and this is her today. She says, I look and feel like I did when I was 20 years old. And this is and don't forget that she's part of the 1/3 of a million patients that we've treated with the protocols that I discovered in my clinical trials who we've helped. And we have had incredible performance, including my own wife, Gail, who I reversed out of Hashimoto's. Finally, this is Olivia from Australia. She's so sick. This is her today. She tells me that she was suicidal. Horrific direction, extremely, I've just highlighted a few of these things. Terrible acne, chronic headaches, non-existent sex drive, no motivation. And after 18 months, right, here she is talking about herself. She's 25 kilograms lighter. She's actually 30 kilograms now lighter. She's lost about 70 pounds in weight. And she's full of energy and she's extremely happy with her new life. Extremely happy with her new life. Here's a few quotes by very well-known doctors. This one here, Dr. Ken Holtorf, many of you would have heard of. He's very well-renowned and a sought-after speaker. You will hear him speaking perhaps you won't. In a few minutes, I'm just going to say. But he said that this was, if I had have known about the Thyroflex, this was about 25 years ago, I identified the underlying cause, I would have avoided the gastric bypass surgery on one of his patients. This one here is Dr. Susser, and he's talking about the getting back to old-fashioned medicine. This is one of our patients from the Philippines. Whoops. This is from the Philippines, saying that she's not a very good tablet taker, but she's just taken a few of our tablets and she's put all of her friends, she's been recommending everyone because she's never looked back since going on the protocols. We are a mini pharma. I have formulated them with along with my head pharmacist. We manufacture 60 specialty hormones. These are now, most of these are now available from in about 10 days' time when our first shipment arrives in India. Now, to summarize, I'll tell you why our medications are so different and why they're absolute top performers, right? First of all, as Dr. Prudence Hall just said, she uses natural bioidentical. All of our hormones are natural bioidentical. We don't use synthetic. There are no binders, no fillers. Our T1, Thyroid has T1, T2, T3, T4, and T7. And then we also put in it the uptake nutrients that you need at time of taking. We do not have binders and fillers, and we put them into vegetarian capsules. They are, and both Dr. Nomi and Dr. Prudence Hall have been using these for years, and her patients absolutely love them, as does the enormous amount of patients we have on these in and around the world. Our D3K2 is not synthetic. You can only get synthetic in India. Ours is derived from the wool of New Zealand sheep, pasture raised. Our K2 and MK7 is from natto fermented underground in Japan. And we discovered, which no other D3 on the market can do, how to increase the uptake of it by of the D3 by 380%. That's really, really amazing. But we do research. We know how to make all of our medications. I just covered two here. I could go on and on and on about iodine, and our adrenal support. But I just covered two of them just to show you why our medications are so effective. If you were going to drive from New Delhi to Mumbai, you can either drive in this one here, right? That is synthetic T4, or you can drive in a Rolls Royce in air-conditioned comfort. That is what we offer our patients. This or this, this or this. It makes such a world of difference in having the absolute highest quality, highest performing medications available to you. Someone just told me that our uniworldhealthcare.com is not up and working, but you can get us at nitecmedical.com. This is a little bonus. Do I have time for a bonus at all? Just a few minutes?
So we have 1 minute.
1 minute, okay. I know how to make a baby genius. An Einstein. I know how to raise the IQ of a baby from preconception by 11 to 12 points. Right? It's with the use of iodine. We give the mother right now prenatal medications, right? But what we don't make sure is that the mother is taking adequate amounts of iodine. Both Dr. Nomi and Dr. Prudence Hall mentioned this in their presentations. Iodine and iodide is required to make the mylar in the neurotransmitters solid in and around the electrical impulses. Not enough mylar, which is what the iodine does, it short circuits. It causes the ADHD and it lowers the IQ. But simply giving the mother the correct amount of iodide, and that's what Dr. Prudence Hall and Dr. Nomi Kunana were just saying, not only does it help the mother, it increases the IQ of the unborn child and will get rid of all of the alphabet soup and the learning difficulties that these young children are faced with today. You can end up with a thing called a smart genius. Thank you very much, everyone.
Thank you, Dr. Daryl. That was very informative. And there are a lot of questions in the chat. I'll take one question and I'll request you to please stay back and answer a few of them. So now that you have spoken about the Thyroflex test, many are asking where can we take it? So as one has to be physically present to take this test?
With a Thyroflex test, you can go to any one of our 15 centers we have in India.
Okay.
Some are clinics, some are hospitals, including Dr. Pretty. But quite a few of the doctors are already online with us today in India, have our machines. We have another 12 clinics that are putting these machines in throughout India. So that they can treat the patients adequately and accurately.
Sure. So I'll ask
That
our
that
team.
list is available through uniworld.com, uniworldhealthcare.com.
All right. Yeah. So that answers another question, because some of them did ask how can they get the products you were talking about. So I'll ask our team to connect with you so that you can give the list of centers where Thyroflex is available, and those who are interested can go and get a test.
Yes. Yeah. So our staff in India, I have staff on my payroll in India. They will, if they contact uniworldhealthcare.com, and the numbers on the website, they will tell them exactly where all of the centers are. But Dr. Pretty, who's waving at me now, she has a Thyroflex machine. She'd love to test some wayward people if they wander over to her clinic.
Sure. We will guide them to her clinic.